Hi, this is Brianna Gunther, Grace Love Bonful, and Chrissy Baker. We will be presenting our curriculum review assignment. We are curriculum consultants and we will present the following topics: identification of relevant and important stakeholders of the program, evaluation of the program philosophy, including analysis of alignment with the institutional philosophy, mission, vision, and values, discussion of the relevant professional standards selected by the program, evaluation of the program outcomes, curriculum design, identify and describe the curriculum design and discuss whether this is the most appropriate design, discuss the accreditation agency selected by the program, and discuss the incorporation of caring theory in the program curriculum. This is a little background information on the Higher Education University. It is a residential private liberal arts institution that offers pre-licensure nursing program. The students can earn a baccalaureate degree in nursing, and it is accredited by the Commission on Collegiate of Nursing Education, CCNE. The Georgia Board of Nursing is the approval agency. The students complete a total of 120 credit hours over 6 semesters, and it has a concept-based curricula.
So this is Grace Love. For our stakeholders in the relationship building part, the relevant stakeholders for this university are the students, because they are the main recipients and consumers of the education that is being provided according to Chance Dominguez 2020 and Cornwall 2022. And they also say that the success of the program is highly dependent on the student and their performances. 2, the hospitals. The hospitals enhance clinical placement and provide clinical experience and structure to the students' clinical education. And this helps the student to build competency and skills, according to Jaya Sikara 2018 and Leone 2021. Lastly, the last stakeholder will be the faculty, and they deal directly with the students through teaching, and they are the main assessors of the students' performances and skills, and they also take and make decisions in the school by way of being parts or members of departments, and this is according to Weatherton et al. 2024. Now, one way to build relationship, according to Watson's caring theory, is that all stakeholders must work together to provide a nurturing environment that promotes understanding, education, and growth, not only between the students and faculty, but also between faculty and also the rest of the staff that is within the school.
After evaluating the program philosophy, the curriculum consultants and I feel that the program philosophy is appropriate and complete. The program philosophy has a strong core statement. Additionally, the institutional and programmatic philosophy, mission, vision, and values align well with emphasis on the need for the students to become thoughtful and caring members of society upon graduation. The nursing program's philosophy contains the values within the philosophical statement, whereas the university chose to write the value statement separately. However, the core values are similar in that they both mention the importance of diversity, respect, integrity, and caring. One suggestion for improvement would be to revise the program philosophy to include more evidence-based literature to better support diversity in the program's philosophy, Carrasco and Jones 2025. Another suggestion to revise the program's philosophy would be to incorporate brain-based learning theory, Watson's caring theory, and/or Kolb's experiential learning theory. The institutional and programmatic philosophies both strive to take a holistic approach to educating students. Therefore, the program philosophy would benefit from brain-based learning theory and Watson's caring theory, as both of these theories recognize that emotions and stressors affect optimal learning and prioritize caring for individuals holistically. Kane and Kane, 1991, and Watson, 1979. Kolb's experiential learning theory would also benefit the program's philosophy by promoting student-centered, diverse, and holistic learning environments. Kolb, 1984.
The University of Higher Education's nursing program follows the American Association of Colleges of Nursing, AACN, Essentials of Baccalaureate Education for Professional Nursing Practice, AACN 2008. A strong fit for the pre-licensure BSN program. The curriculum reflects the university's mission and supports holistic care, diversity, ethics, leadership, and critical thinking. These principles are integrated across the semesters from foundational courses like concepts of patient relationships to more advanced topics in nursing professionalism and evidence-based practice. Capstone assignments and clinical experiences further develop leadership and real-world skills. Suggestions for improvement include, first, transitioning to the updated 2021 AACN Essentials to better address today's healthcare priorities, AACN 2021. Second, creating a comprehensive curriculum map that shows how the courses align with the updated domains, especially in areas such as health equity, informatics, and population health. Halstead 2020 AACN 2021. Third, implementing faculty training programs that would use standardized rubrics for more consistent clinical evaluations. Orman and Gaberson 2021. And finally, collecting inter-rater reliability data across all clinical courses to provide solid evidence for the accreditation. Kirkpatrick 2021.
So when it comes to the program outcomes and alignment, they both are complete and they align with the program philosophy and the professional standards, which are the essentials of baccalaureate education for professional nursing practice. The program outcomes focus on leadership, population health, evidence-based care, advocacy, and professionalism, which also aligns with essentials 1 to 9 of the essentials, and it also encourages leadership, population health, advocacy, professionalism, and evidence-based care. Now, the addition of a technology-based outcome, such as students learning about electronic health records and artificial intelligence and its role, is one way to enhance the programs, or an addition that they can add, because according to Bajwa et al. 2021, it is one area where healthcare workers struggle, and so it could be added to ensure that students are building this competency and skill before they find themselves in the workplace.
The Higher Education University's BSN nursing program uses a concept-based curriculum design. A concept-based curriculum focuses on larger, broader ideas known as concepts that are seen in multiple courses with increasing complexity. Concept-based curriculums are designed to promote critical thinking skills and student application of knowledge. Giddens et al. 2008. Concept-based curriculums can be overwhelming and challenging for some students. Aluma 2020, Alomari et al. 2024. The concept-based design is appropriate for nursing programs, as critical thinking skills and the application of learned knowledge are essential skills that nurses must develop to be safe, effective nurses. Callaghan 2018. A concept-based curriculum may result in more generalized learning, thus making it challenging for some students to apply knowledge in complex clinical situations without adequate practicum experience. Russell et al. 2019. A recommendation for improvement could be to incorporate an advanced simulation course in the curriculum to promote realistic scenarios and increase clinical hours in pediatric settings. Simulation can be especially valuable in pediatric nursing, where clinical placements can be challenging to find and obtain. Institute of Pediatric Nursing 2021. Another recommendation to enhance the curriculum could be to include more interdisciplinary learning experiences. These opportunities would enable nursing students to collaborate with professionals from other healthcare disciplines, helping them develop the teamwork skills essential for delivering coordinated patient-centered care. Jose Tuzanos et al. 2021.
Our accrediting agency is the Commission on Collegiate Nursing Education, and it is appropriate because it ensures the curriculum reflects the goals, mission, and expected student outcomes of the program. It also ensures the incorporation of the essentials, which are the core competencies for professional nursing education, and also ensures that the curriculum requires a clear strategy on how it is going to meet the professional nursing standards and guidelines, and also ensures clinical experiences, promotes interprofessional teamwork, and ensures that the nurses are being prepared to provide care to diverse populations. Now, when it comes to the evaluation plan analysis, the accrediting standard for the evaluation plan is standard number 3, which is curriculum and teaching learning practices, and it comes in A, B, F, G, H, I, J. Now, for standards A, B, 3A, B, F, it focuses on curriculum development and implementation and ensures that the curriculum reflects the relevant professional nursing standards and guidelines that are seen within the curriculum and the expected student outcomes. It also ensures that the students are building on a foundation of art and science, and the curriculum does this by ensuring that students complete a certain number and type of classes before they get accepted into the program. And documentation of this can all be seen in the student handbooks and also in the student outcomes, and also in the undergraduate curriculum minute meetings. For GHIJ, it focuses on the teaching and learning and evaluation methods. And for example, the teaching or the classroom methods such as lecture, simulation, and clinical experiences are some of the ways or the teaching methods used in this curriculum. And also, for example, for the clinical experiences, students are usually put in groups of 6 and led by an experienced clinical instructor for 10 hours every week. And evaluations also include peer evaluations by the program director and also the clinical learning center, and student evaluations. And evaluations will primarily done by the faculty, and with an established 75 being the passing standard for students. And this plan is also assessed by the committee once every semester, and peer evaluations also occur at the end of student evaluations also occur at the end of each course. And as of now, there's still an ongoing review with about 80% of peer review for faculty, 75% of the program director's evaluations, and 12 to 51% of the student evaluations.
Based on the information from the evaluation plan, the site is marginally ready for an accreditation site visit. The program evaluation plan includes the key elements determining whether the program substantially complies with each standard outlined in the CCNE 2024. The HEU has plans for continuous quality improvement tracking with a systematic process that includes expected outcomes where surveyors can find important documents, responsible parties, action plans, and more required information. Keating 2018, Welch 2021. Additionally, HEU responds substantially to each section of the CCNE Standard 3, Keating 2018. Each section of the program's evaluation plan has supporting documentation mentioned with ongoing review to ensure evidence-based and up-to-date standards are met to comply with the CCNE Standard 3. A key recommendation for HEU is to transition from the 2008 BSN Essentials to the updated 2021 AACN Essentials. Clinical evaluation tools also need immediate revision, especially since inter-rater reliability was lower than desired. A concern when multiple faculty use the same rubric for clinical evaluations. Kirkpatrick 2020. An action plan is also needed for the 4 clinical facility contracts that expired in 2020, as no renewal or replacement plans are listed. While the overall system is solid, a mock accreditation visit is recommended to uncover any remaining gaps. Keating 2018. Also, completing all faculty evaluations, currently only 75 to 80% complete, and shifting the program review cycle to every 3 to 5 years, as Keating 2018 suggests, would align better with accreditation expectations and support ongoing quality improvement. After reviewing Higher Education University's nursing program, it is evident that caring is a central theme in the mission, philosophy, and values, including the core value statement, "Nursing exists to create relationships that promote caring." Although a few courses address caring, particularly concepts of patient relationships, the curriculum lacks a defined theoretical framework. A recommendation would be to implement Watson's theory of human caring, which aligns closely with the program's values. Reflective journaling during clinicals can help students explore meaningful patient interactions. Sitzman and Watson, 2018. Additionally, documenting personal caring experiences may support students in connecting theory to practice. Adamski et al., 2018. These steps would reinforce caring-centered approach with a stronger theoretical foundation.
In summary, HEU did well to prepare for site accreditation visit and will be ready with a few recommended improvements. HEU's stakeholder collaboration supports student success. HEU's program philosophy aligns with institutional mission and AACN 2008 essentials. Our overall recommendations are to revise the program philosophy to include more evidence-based literature to better support diversity in the program's philosophy, Carrasco and Jones, 2025. Also, incorporation of Watson's caring theory, Kolb's experiential learning theory, and brain-based learning theory into the program will enhance the program. Additionally, the incorporation of advanced simulations and interprofessional learning opportunities in the course curriculum can address curriculum weaknesses. HEU's evaluation plan aligns well with the CCNE Standard 3. Additionally, HEU will be ready for an accreditation site visit with a few recommended changes and updates.